Hi everyone, it's Dr. Birnbaum. Today I'm going to talk to you about an amazing case. It's about a lupus patient who was blind, but she maintained that she could see. She denied her blindness. So she was admitted to the hospital with very high blood pressure and chest pain. So the blood pressure and chest pain were treated and then went away. However, the doctors then recognized that she was blind, as I said, but maintaining she wasn't blind. So for example, the nurses would take her towards the bathroom and she would bump into walls, and she said that this didn't bother her at all. So we thought that further studies were warranted. So we did an MRI of the brain, and this yielded some answers. There was some swelling in the back of the brain. It's called PRESS syndrome, which stands for posterior reversible encephalopathy syndrome. Now there's a complication of that in which patients are blind, but they maintain that she could see. This condition is called Anton syndrome. So now there was a debate. What to do? Should we start immune suppressing medications? So there are some physicians who thought that this was a scary brain complication of lupus, that of course she needed immune suppressing medications. What I want to emphasize to you is not all brain diseases that happen in lupus require immune suppressing medications. So I said just to hold off, and we would keep her in the hospital under close investigation, but to hold off on immune suppressing medication. So day 1 through day 2, her condition didn't change, and all of a sudden, day 3, she opened her eyes, she was smiling at her husband, she was smiling at the bouquet of flowers. So again, Anton syndrome is a great, it's a perfect example of a neurological complication of lupus that does not require immune suppressing medications. So you could learn more about autoimmune diseases in my book, Living Well with Autoimmune Diseases, a Rheumatologist's Guide to Taking Charge of Your Health. Thank you.